Welcome to part one of our lecture on anxiety and anxiety-related disorders. This first part will be talking about anxiety and give an overview of the disorders broadly speaking. Anxiety is considered a generalized state of foreboding or apprehension. And what's key to anxiety is that it's out of proportion with the actual threat that the person is facing. So they're anticipating a problem or anticipating something going wrong rather than responding to there actually being a real problem in the moment. When anxiety becomes out of control, or if it's happening a lot, it might become an anxious mood, or it could even become a diagnosable condition. In everyday conversation, we often will say anxiety or say fear and use them interchangeably. So let's take a minute to talk about how they are different. Fear is a response to a real and immediate danger, and it's an appropriate level of response to a real and immediate danger. When we experience fear, we have surges in autonomic arousal that we need for a fight or flight response. We have thoughts about the danger that we're facing, and we engage in escape behaviors. Remember the definition of anxiety. Anxiety is an anticipation of something bad happening or a sense of foreboding that something is going to go on. They're not reacting to a real and immediate danger. They're reacting to something they anticipate happening in the future. With a little bit of adjustment to that definition, they could also be having a current event that they're reacting to, but their reaction is far out of proportion because they're thinking about what else could happen. For example, somebody could be taking an exam and they miss an answer or they don't know, and now they're getting more and more anxious, and it's building and building and building because they start panicking that they won't pass. Anxiety is often associated with muscle tension, a hypervigilance in trying to stay prepared for something bad happening in the future, being very, very cautious, or starting to avoid things that they think might lead to that negative event happening. And when people have pervasive avoidance, it actually creates a larger problem. Pervasive avoidance allows them to reduce the fear that they're experiencing or reduce the anxiety that they're experiencing. But then it actually becomes a feedback loop that worsens the anxiety over time. And this will be really important down the road when we talk about treatment options. One of the things that must happen for anxiety is people actively engaging in the thing that makes them anxious, because the avoidance is making it stronger. But if they engage in it and they do what makes them anxious or fearful, it can reduce that anxiety pretty quickly. Before we talk about any one anxiety disorder, I'm going to give you an overview of the anxiety disorders as a whole. First of all, the anxiety disorders are characterized by excessive anxiety, or anxiety that continues despite them being older than we would expect to see that behavior. So it continues beyond a developmentally appropriate time frame. And we think about excessive anxiety not from the perspective of the client, because clients will often come to believe that their anxiety is warranted, that it's important that they have the anxiety to keep them safe, or they have become skewed in how acceptable the anxiety is. So clinicians are the ones to determine if the anxiety is excessive while being thoughtful about cultural and contextual factors. You'll also notice for the anxiety disorders that thoughts or situations can provoke the anxiety. This could be thinking about a spider, or it could be suddenly seeing a spider might provoke anxious thoughts. Often you'll also see that they have a preoccupation with whatever it is that causes them the anxiety. So because spiders make them anxious, they are thinking about them often, they're on the lookout for them often. But on the opposite end, you could have persistent avoidance, doing everything in their power to avoid coming into contact with the object that causes fear for them, to the point of actually becoming problematic and destructive. And to count as an anxiety disorder, they have to be persistent, meaning that they have lasted for at least 6 months. And what we know is that often we'll see them starting in childhood and then can persist and worsen over time if they don't get treatment. These next two, you're going to start to notice, you will see for almost all of the disorders we're going to talk about this semester. The first being that there has to be clinically significant distress and some form of impairment, whether it's their ability to do their work, their social interactions, their education is interfered with. And the anxiety disorders are often comorbid with one another. And if you remember, being comorbid means it co-occurs. So individuals who have anxiety disorders will often have other anxiety disorders or substance abuse disorders, which may make sense because often people are using substances to control their anxious symptoms, or depressive disorders. And they differ from one another based on the types of objects or the kinds of situations that might provoke their fear, or their anxiety, or their avoidance behavior. So in some cases, we might see that it's a specific phobia, like the spider I mentioned earlier. Others, it might be having to have social interactions and be judged by others. Still others might have concerns about going outside. And across the disorders, you're going to notice that most of them are more common in women than they are in men by a factor of 2 to 1. The anxiety disorders have 3 primary components that combine together and feed off of one another. There are physical features, behavioral features, and cognitive features. The physical features may include being jumpy, jittery, shaking, dry mouth, their heart racing, hard time breathing. Behavioral features would be either being very clingy and dependent, or engaging in avoidance behaviors and maybe being agitated. And the cognitive features include things like worrying about it all the time, having a constant sense that something bad is going to happen, recurring images or thoughts that upset them, challenges with concentration, or being overly attentive to the body sensations that they're having.